If you've tried working out how to take Betaine HCL for digestion and bloating, you've probably run into a few issues. For example, what type of meal should you take with it? When is the best time to take it? And of course, the biggest question of them all, how much to take? Well, in this video, I'm going to answer all these questions for you, and you'll see using Betaine HCL the right way is nowhere near as difficult as getting Wordle right on your first try or learning a dance for TikTok. Let's go. Hi, I'm registered dietitian Rochelle Godwin, and just before we jump into the video, it's worth mentioning that as always, this is not medical advice, but rather for information purposes only. And like with all dietary supplements and gut health protocols, please be sure to consult with your healthcare professional to work out what's best for you personally. So first up, what type of meal should you take Betaine HCL with? Well, to find the answer to this, our research team at Essential Stacks dug into this fantastic 2020 study that appeared in the Journal of Integrative Medicine. In their paper, the researchers found the ideal meal contains at least 500 calories and an adequate amount of protein. In other words, you only want to take HCL when you are eating a substantial meal as opposed to a light snack. And just as importantly, it needs to contain protein-rich foods like meat, seafood, dairy, eggs, or high-protein plant-based foods. For example, a chicken salad using 6 ounces or 170 grams of chicken would meet this definition. By contrast, you don't want to take Betaine HCL with something low in calories or protein, such as a fruit salad or vegetable snack. Not only is this not necessary for digestion, but it can also potentially cause heartburn, the very thing we're trying to avoid. Now, in terms of when to take Betaine HCL, we've seen some confusing takes on this in the health space lately. So let's clear this up once and for all. So first of all, it's worth noting that HCL works really fast. In fact, it might just be the Usain Bolt of the digestion world. In this 2013 study that appeared in the journal Molecular Pharmaceutics found, HCL starts to take effect just 6 minutes after being ingested. In addition, HCL works to support the acidity of the stomach, which is only important when your body is digesting a meal, not before and not long after. So with all of this in mind, it is best to take Betaine HCL just as you begin eating or even during your meal, but no earlier or later than this window. You see, if you take it any earlier than this when it is not needed, it can create a false positive of heartburn-like symptoms. And if you take it any longer, it might not work so well since the food will already be digesting in the stomach. Now, how much Betaine HCL should you take? Well, this depends on 2 things. First of all, what type of meal are you eating? Meaning, how big is it? And how much protein is in it? For example, if you're eating a big dinner with an 8 to 12 ounce steak plus some protein-rich veggies like asparagus and spinach, you might want more HCL than someone eating a small ham and cheese sandwich. And the second thing that it depends on is how much acid your stomach is currently making. If it's very little, then you might want to take more HCL than other people. By contrast, if you're just a little bit low in stomach acid, you might not need much supplemental HCL at all. To help you work out the right amount, researchers came up with a simple challenge you can do at home. It's called the Betaine HCL Challenge Test. And don't worry, you're not getting graded, but you should definitely do this under the supervision of a healthcare professional. So this test was detailed in the 2020 paper we mentioned earlier in the video, and the researchers summed it up to this, quote, "This protocol involves giving patients increasing doses of Betaine HCL at mealtimes until such time as noticeable discomfort is reported," unquote. And when they say discomfort, they are referring to things like heartburn, diarrhea, a warm sensation in the chest, or any type of bodily discomfort. And once that point is reached, you reduce the amount of HCL with each successive meal until such time as you have no discomfort. And to show you how the test might be done, here's an example. And bear with us for a minute as we go through, as we want to make sure it is clear. So day 1, you would take 500 milligrams of HCL with a protein-rich dinner. For example, grilled salmon with spinach and sweet potato. If no discomfort is felt, then your stomach acid is still low, so you'll want to repeat the challenge the next day. But before moving up to a higher dose, you want to retest the 500 milligram amount. If you once again experience no discomfort, then you can try a higher dose of HCL the following day. In this example, and to keep things easy, you might try 1000 milligrams on day 3. And if there is still no discomfort, then you retest, and so on. Now, the minute you feel discomfort after a meal, you found your maximum dose and you should not take this amount again. From here, you gradually decrease the amount by 1 capsule each meal until you reach a tolerable dose that improves your digestive symptoms and doesn't cause heartburn, meaning your Goldilocks zone of HCL. And an important tip before we go on, if you experience extremely uncomfortable symptoms during the challenge, you can neutralize the acid by mixing 1 teaspoon of baking soda into water or milk and drinking this. If you look at all the different Betaine HCL supplements out there, they come in a variety of different dosages. Some are 250 milligrams, some are 500 milligrams, and then others might be 648 or 650 milligrams. Here at Essential Stacks, we make ours with 500 milligrams of Betaine HCL per capsule. And that's because most studies have used 500 milligrams as the interval between doses, including ones mentioned in the 2020 paper. So it works really well for easily titrating the dose up or down as part of the Betaine HCL Challenge Test. Probably just as important, it can be worth looking for an HCL supplement that also contains pepsin. In fact, if we look at the study in the Journal of Integrative Medicine, they specifically mentioned that consuming Betaine HCL with added pepsin may be superior for overall benefit, meaning it can help you digest the protein in your food even better than HCL by itself, which is why you'll see we have also incorporated pepsin into upgraded Betaine HCL. And if you want to learn more about it, you'll find a link in the description below. And that brings us to the end of the video. And now we want to hear from you. How much HCL have you found that works for you? Let everyone know by leaving a comment below. If you enjoyed this video as part of our digestion series, then hit the like and subscribe button to make sure you never miss another video. Our team of dietitians and doctors here at Essential Stacks are so excited to continue researching which foods and supplements help your gut health. That way you can save hundreds of hours of trial and error and focus on what's best for your digestive health. Thanks for watching and see you in the comments. Bye for now.